Complications of total parenteral nutrition include all except hypoglycemia. So it includes hyperglycemia, hyperchloremic alkalosis, and electrolyte abnormalities. Which of the following is not an important cause of hyponatremia? Prolonged Ryle's tube aspiration is not an important cause of hyponatremia. Gastric fistula, excessive vomiting, and excessive sweating is an important cause of hyponatremia. In a patient of total parenteral nutrition, daily monitoring is done with body weight. Which of the following nutrients are not included in total parenteral nutrition? Fiber is not included, lipid, carbohydrate, and protein is included. The complication of prolonged parenteral hyperalimentation may include the following except hyperphosphatemia. So it may include cholestatic jaundice, hyperosmolar acidosis, and hyperammonemia. Now, blood transfusion, half-life of factor 8 is 8 hours. Massive transfusions result in DIC, that is disseminated intravascular coagulation, hypothermia, and thrombocytopenia. Incompatible blood transfusion is diagnosed in a patient under deep anesthesia by increased capillary blood loss and persistent fall of blood pressure. Stored plasma is deficient in factor 5 and 8. Rosenthal syndrome is seen in deficiency of factor 11. Which of the following is better indicator of need for transfusion? Hematocrit. Blood platelet in stored blood do not remain functional after 24 hours. Cryoprecipitate is a rich source of factor 8. The maximum life of a transfused red blood cell is 50 days. Massive blood transfusion is defined as whole blood volume. How long can blood stored with CPDA? 28 days. Massive transfusion in previously healthy adult male can cause hemorrhage due to dilutional thrombocytopenia. Mismatched blood transfusion in anesthesia presents as hypotension and bleeding from site of wound. Platelet can be stored at 20 to 24 degrees centigrade for 5 days. Which one of the following blood fractions is stored at 40 degrees centigrade? Cryoprecipitate. With reference to fresh frozen plasma FFP, which one of the following statement is not correct? It is used as volume expander is incorrect. It is stored at minus 40 degrees centigrade to minus 50 degrees centigrade. It is a source of coagulation factor. It is given in a dose of 12 to 15 milliliter per kg body weight. Stored blood which has been preserved in a blood bank is deficient in which one of the following coagulation factor? Factor 5 and factor 8. Now, shock. Features of hypovolemic shock are all except bradycardia. So what are the features of hypovolemic shock? Oliguria, low blood pressure, and acidosis. Blood clot, the size of a clenched fist is roughly 500 ml, equal to 500 ml. Following is the most important factor in the management of shock: deficiency of effective circulation. Cortisol level returns to normal 3 days after hemorrhage. One of the following is the earliest indication of concealed acute bleeding: tachycardia. The most important cause of death in septic shock is cardiac. Shock is clinically best assessed by urine output. In Glasgow Coma Scale, all of the following are considered except sensory response. So what is considered in Glasgow Coma Scale? Eye opening, verbal response, and motor response. The first permanent molar erupts between 6 to 7 years. Differentiating features between sepsis and trauma are none of these. IV fluid replacement volume and rate in a trauma patient is determined by urine output. All of the following are indicators of adequacy of pre-operative resuscitation except C-reactive protein level. So, which are the indicators of adequacy of pre-operative resuscitation? Consciousness level, urine output, and hematocrit level. Mangled extremity severity score MESS include all of the following except neurogenic injury. So it includes shock, ischemia, and energy of injury. Now, infection golden period for treatment of open wound is 4 hours. Hypotension in a case of gas gangrene is best treated by ringer lactate. Commonest form of actinomycosis is fasciocervical. Regarding tuberculous lymphadenitis, which is correct? It is seen in children and young adults. History of contact or drinking infected milk, mostly cervical, which is not true of carbuncle. That it is caused by streptococcus is wrong. Infective gangrene of subcutaneous tissue caused by staphylococcus. Diabetics are more prone. Penicillin and excision of necrotic tissue is the treatment of choice. The sensitivity of Cazzoni's test is 90%. Sardonic grin is associated with tetanus. Tetanus is caused by Clostridium tetani. Commonest cause of cellulitis is streptococcus. Foaming liver is seen in gas gangrene. Erysipelas is caused by Streptococcus pyogenes. Hyperbaric oxygen is useful in gas gangrene and frostbite. Commonest form of anthrax is cutaneous type. Malignant pustule occurs in anthrax. Actinomycosis is sensitive to penicillin. Globi is seen in lepromatous leprosy. Which of the following parts of the body is not affected by leprosy? Ovary is not affected by leprosy. Leonine phases is seen in lepromatous leprosy. Most commonly affected peripheral nerve in leprosy is ulnar. Moth-eaten alopecia is seen with syphilis. Moon's molar are seen with syphilis. Which of the following about yaws is incorrect? It is sexually transmitted is incorrect. It is caused by Treponema pertuni and spread by direct contact. Penicillin is used as treatment. Scrumpox is seen among rugby players. Which of the following is incorrect regarding carbuncle? That it is common before age of 40 is incorrect. It is a staphylococcal infection and common in diabetes patient. Males more common. Following are true of erysipelas except that it is contagious and infectious. No. Common in tropics. No. So what is true is that it is a streptococcal infection and margins are raised. Chronic thick-walled pyogenic abscess may be due to the following except virulent strains of organisms. So chronic thick-walled pyogenic abscess may be due to presence of a foreign body, prolonged antibiotic therapy and inadequate drainage. Following may be premonitory symptoms of tetanus except urinary incontinence. So which are the premonitory symptoms of tetanus? Sleeplessness, anxious expression and headache. Ampicillin prophylaxis is given in biliary surgery. Treatment of spreading streptococcal cellulitis is penicillin. A patient with a fistula and chronic pus discharge from lower face and mandible is most commonly suffering from actinomycosis. Multiple fistula in ano commonly occurs in tuberculosis and IgV. Medical management of hydatid disease is indicated in moribund patient. Thymus gland abscess seen in congenital syphilis is called Dubois abscess. The HIV virus can be transmitted by the following route except intact skin. The high risk group for transmission of HIV virus include the following except healthcare worker. Treatment of contaminated wound in gas gangrene is debridement of wound and systemic penicillin. A carbuncle is treated by incision and drainage and wide excision. Painless effusion in joint in congenital syphilis is called Cluton's joint. A mentally retarded child aged 12 years has multiple painful discharging shiny white lesions around the anus. Which of the following is the most probable diagnosis? Syphilitica condyloma. A boil is due to staphylococcal infection of hair follicle. Incubation period of gangrene is 1 to 3 days or 4 to 6 days. In AIDS, lymphadenopathy is most often due to non-specific enlargement of lymph node. Roundworm causes following except. So roundworm can cause all of these: gallstone, cholangitis, hemophilia and pancreatitis. True about cellulitis of lower limb. Infection of skin and subcutaneous tissue. Fever and malaise are common. Margins are distinct and involved site is red and hot. Fallman's balanitis is caused by none of these options. When do we have to start antibiotics to prevent post-operative infection? 1 hour before surgery and continue after surgery. Non-surgical infections in surgical patient, LRTI and Clostridium difficile diarrhea. False regarding carbuncle is that it is common before age of 40. It is a staphylococcus infection. It is a painful condition and males are commonly affected. Universal or standard precaution to be observed by surgeon for the prevention of hospital-acquired HIV infection include the following, except pre-operative screening of all patients of HIV. So what is the preventions? Wearing gloves and other barrier precaution, washing hands on contamination, and handling sharp instruments with care. Regarding antibiotics, true are prophylaxis for colorectal surgery. Period of onset in tetanus refers to the time between first symptom to spasm. All the following are true regarding R5 strain of HIV except predominate in late stages of HIV. So what is true about R5 strain? Utilizes CCR5 co-receptor, transmits HIV efficiently, and infects microglial cells. Preferred time for prophylactic antibiotic administration for surgery at the time of induction of anesthesia. In a surgical patient, the causes of non-surgical infection are all except wound infection. So what are the non-surgical infections? LRTI, Clostridium difficile diarrhea, and UTI. False about cellulitis, localized infection and abscess, if any, should be managed conservatively, is false. What is true about cellulitis? Caused by Streptococcus pyogenes and causes SIRS, and incision and drainage of abscess should be done. A patient is diagnosed with gas gangrene of the foot. Best management would be antibiotics with surgical debridement. Best skin disinfectant for central line insertion is chlorhexidine. Best treatment for gas gangrene is debridement with IV penicillin. Commonest complication of immunosuppression is infection. Highest chance of success in renal transplant is seen when the donor is identical twin. Commonest indication for liver transplantation in infant is biliary atresia. Principal cause of death in renal transplant patient is infection. Following drugs are known as known immunosuppressive agent except cephalosporin. So which are the known immunosuppressive agent? Prednisolone, azathioprine, and cyclosporin A. Transplantation of kidney from mother to son is an example of allograft. Site of transplantation in islet cell transplant for diabetes mellitus is injected into the portal vein.